So I'm Dr. Karen Rabin from Baylor College of Medicine and Texas Children's Cancer Center. Um, I wanted to give a little information about whether modified chemotherapy regimens can improve outcomes for pediatric patients with Down syndrome and high-risk B ALL. So children with Down syndrome have historically had poorer outcomes, both increased risk of relapse and increased risk of treatment-related mortality during treatment for ALL. And the trial prior to AALL 1131, which is the most recent completed trial, the trial prior to that was called AALL 0232. This is in the Children's Oncology group treatment protocols. And that trial, unfortunately, was closed permanently to children with Down syndrome because of excessive treatment-related mortality. There was primarily sepsis and during times of profound neutropenia, and it resulted in an excess mortality, despite some amendments to the protocol to try to mitigate the risk. So the task for AALL 1131 was to try to come up with a regimen that would be safe and have improved outcomes for this population. Some of the modifications included changing from a 4-drug induction that includes anthracycline to a 3-drug induction for nearly all patients, except for those who were slow early responders based on a bone marrow at day 15. And then giving leucovorin rescue after all intrathecal methotrexate and giving a modified IV methotrexate during interim maintenance that only went up to a maximum of 2 grams per meter squared with earlier leucovorin rescue at 30 hours. And then there were really enhanced supportive care guidelines with recommendation for antifungal and antibiotic prophylaxis, immunoglobulin replacement if needed, and really conservative management, aggressive management with broad spectrum antibiotics, and remaining inpatient in the hospital throughout the intensive periods of chemotherapy until early count recovery. So with all those changes, AALL 1131 did meet its objective of being safer. The goal was to have an induction death rate less than 10%, and it was 4.7%. And there were also improved outcomes in terms of being able to complete the trial and look at the event-free and overall survival. The event-free survival for Down syndrome patients was 69.1%, and the overall survival was 83.3%. So these are an improvement in general over the large retrospective data from the Ponte de Leño group that had been published previously. And however, there were still elevated induction deaths, post-induction mortality, and relapses compared to patients without Down syndrome. So this was a successful trial in terms of improving outcomes and being able to safely complete a trial and meet some benchmarks for improvement. But we still have more work to do, and really using targeted therapy and immunotherapy, I think, is the hope for trying to further improve outcomes for this group, because the therapies such as blinatumomab or inotuzumab or chimeric antigen receptor T cells can have a potent efficacy against leukemia and also have less toxicity. So hopefully may lead to even more advances in the future.